And that's why it's important to think about the people who are moving forward with treatment. They are the ones overcoming the bias. The ones who are not moving forward with the treatment, they're not overcoming the bias. And your staff can help. Hello, and welcome to the Physician Growth Accelerator, a show where we break down your practice system into vitals, give you the tools to diagnose root cause of what may be restricting your growth, and prescribe what to do about it. I'm your host, Zed Williamson, and I believe that every system is perfectly designed to get the result it gets. This brings you freedom as a business owner or manager because you can wrap your head around the concept that whatever you're dealing with, it's the perfect outcome of a system designed to do it. And maybe you didn't build the system on purpose to be that way, and maybe you don't like the result. But the value is, once you understand that it is part of a system, all we have to do is tweak the system to get a different, perfect outcome. So today, we are talking about bias related to treatment. You see patients in need. They've been to your office. You've done the diagnostics. There's clear evidence that they should move forward with treatment. They would feel better. They would be out of pain. It would be good for all. And some of them don't do it. So let's go back to it being a system. This is a perfect outcome of a system designed to create it. And I will tell you that practices all over the country have different percentages of people going through to treatment. And what I'd like you to do is start to wrap your head around the idea that that is part of your current system. If someone does more procedures than you, what we tend to do is say like, well, they're over-treating, or well, they're using a different algorithm. It's more likely the communication with the patient, and more patients are choosing to move forward with treatment. And you might think to yourself, all right, well, if a patient comes to me with a problem, I figure out what the issue is, and I present a solution. If they don't move forward, that's on them. You're right, it is. And I want you to think about the people who do move forward a little bit differently. The patients that you see that move forward with treatment are likely overcoming huge biases against it. And the ones that aren't coming to you, they didn't overcome that bias. Now, if you are someone in pain and under stress, your automatic decision machines, bias and heuristics, are driving your behavior all the time. And I think it can be in our power to help patients through those things. So let's do we're going to break down some biases that really impact this. And I want you to think about patients you've talked to and maybe your interaction with patients or your office's interaction with patients to see if any of this makes sense, that it might be a bias that is holding people back from treatment. So first, let's talk about ambiguity effect. Ambiguity effect is this concept where if we don't understand the clear picture, we don't move forward. And it's not just because we don't understand it, but because we assume worst case scenario. And what you'll hear from patients is you'll hear questions like, how long's recovery? Because what they don't want to ask is this going to hurt a lot? And so what happens is when they don't ask the real question and you answer the non-real question, they're actually forced into this ambiguous spot. Ambiguity effect comes into play. And now they're thinking, worst case scenario, this is going to be the worst thing ever. There's no way I'm doing it. I guess I'm not that bad off. And they don't show up for treatment, or they don't come back, or they don't schedule. Or they say like, oh, doc, yes, let's rock and roll, woohoo, yoo-hoo. And then they walk down the hall to the person that does the scheduling, and they don't have their calendar on them, or they're going to have to get back to them, or they're thinking about these other things. So ambiguity effect really hurts conversion from an appointment to a treatment. Now, what if you are super clear and you're saying, Zed, that is not the issue. We have a very mapped out process. There are a lot of other biases. Negativity bias, where they only focus on the negative And let's say it's a knee replacement procedure and there's downtime and they're kind of working through some pain right now. And negativity bias is going to have them remember all the interactions they've had with other people when those people have talked about their knee replacement. And they're going to think to themselves, what if I do this surgery? I'm down for all these months and then it's not any better. That happens. These are things that are going on in the mind of the patient. What could you do in that standpoint? Just call it out. Some patients get concerned that they may think, I'm going to go through all this, and what if it's no better in the end? Just stating it gets the patient to realize, okay, I'm not crazy. Other people think this, and it helps the conversation move forward. Another bias that might affect this that you may not think about is mental accounting. So mental accounting bias is where we put different value on money based on the bucket it's in. So let's say someone has a deductible, and the deductible is going to cost them a couple $1,000s out of pocket. And so they use that as a reason to not move forward. And what your office will say is, Bob couldn't afford it right now. And everyone goes, man, that's tough. Well, I hope Bob can figure it out. And then Bob walked out of your office, went down the street, and bought a boat. And the reason is because of mental accounting. And so what can you do about that? Is just talk to the patient about what's important to them. Talk to them about what this means long term. You can, if they have a $2,000 deductible, you can train your staff to say things like, Bob, if you could have not dealt with this for the last year, would that have been worth it? Oh, yeah. And that helps someone out of that specific bias. There's omission bias. Omission bias is really interesting, where even though we are in pain, we see a decision of our own. If there's a negative impact from that decision, that's worse, even if the pain is less than the current pain. And this happens because of information overload. I mean, imagine how many patients can go to Google and they learn all kinds of crazy stuff. They watch YouTube videos of, surgeries, and they are just freaked out because of the assumptions they're making. And when you're talking to them, you talk about a small incision and they're thinking, you've got a meat cleaver. And that's bias getting in the way. The reason why this is important to understand is it's easier for you to think logically about a patient being treated. It's easier for your staff to think logically about that patient being treated. And sometimes what we do is we put it on the patient and we say, what is this person thinking? They are clearly in pain. They are clearly suffering. Are they just not smart enough to go through with it? They just don't get it? And I caution you, if that ever comes into your mind, I caution you to be aware of it within your practice, because that's not what's happening. Humans are not logical beings. Sorry. Hate to break it to you. When you're being logical, it's probably because the decision doesn't really affect you much. Once the decision affects you, it goes to all emotion. And so even though in a court, if there was a medical court of law where you could present your data and say, I believe this patient should be treated, and the judge would go, agreed, patient gets treatment, and you know that you would pass in that world because everything is stacking up against it, the patient still has these biases that they have to overcome. And everyone is doing it. And that's why it's important to think about the people who are moving forward with treatment. They are the ones overcoming the bias. The ones who are not moving forward with the treatment, they're not overcoming the bias. And your staff can help. You can think out of the box. You can think about, hey, let's send them a FAQ video where we just answer the most common questions. When patients ask questions, instead of answering it right away, you could say something like, it sounds like you have some concerns about this procedure. What kind of things are you worried about? You just get it out. You can talk to your surgery scheduler or whoever does the scheduling. Get them to ask questions like that. Allow the patient to come back in and ask more questions. There's over 180 known biases and heuristics, and most of them are working against you as it's related to a patient deciding, hey, I want treatment because I want to feel better, because they've attached so much negativity to the idea of treatment, to the idea of downtime, to what all those things mean. And there's all those biases that can get in the way of that patient feeling better. And if we truly care about the patient outcome, and we see someone that you just know that you can help, then I believe that we should take a little ownership of helping them through those biases. And it's just about paying attention. It's about communicating. It's about understanding their emotional position. Because you might be right and they're right also. So in that scenario, we have to figure out a way to get shoulder to shoulder, get an understanding. They may be thinking something that you believe is absolutely insane. They're thinking of some complication and you're saying, that happens once out of 10 billion times. How could you possibly make a decision to not have this treatment based on that? I know that what goes through your head. And just realize that their brain is set up to survive today. And that bias is going to keep them from taking action. So instead of looking at people who don't move through the treatment as like, well, I guess they weren't bad off enough, think about how you can communicate with them. Think about how you can connect and understand truly what is in the way of them taking the step to feeling better, because you know you have the tools to help. And so now let's use additional tools so that you can help them with that decision. If you want to check your vitals, go to physiciangrowthaccelerator.com and click on vitals. And we'll see you next time on the Physician Growth Accelerator. Thanks.